My name is Jennifer Yoon. I am actually a master's student at U of T. Nursing, much like most other clinical professions, there's a very big focus on practice. I think what tends to get blurred is the connection between policy and practice. And the other flip side of that is often nurses have reported that they feel powerless, or they feel very strongly about an issue, say care that should be delivered to the patient, but they don't know necessarily how to advocate for that. So the reason why we had this simulation and this exercise put on today was to help teach students about the advocacy part, and hopefully they would bring the skills that they had learned to their clinical practice.
They found they were trying to teach women that you breastfeed and you've got AIDS, you're going to give your child AIDS. They gave them a formula to feed their babies with. A lot of the women didn't use it because by feeding them the formulas, they were announcing to everybody else in that village, I have AIDS, and they would be ostracized. So, I mean...
Well, I guess that's where the culture would come in, and if we're sending teams over there, of course, those teams have to be culturally competent.
Yeah.
I'm Sherry Nataba from Humber College, 4th year nursing student. I wrote my self-reflection from my professional development plan, and I wanted to actually write my paper, my policy advocacy paper this semester on maternal health advocacy.
In the short term, developed nations should create a pool of human resources that will travel to developing countries and inculcate primary health care education to facilitate exchange of information.
Here, it's very different. It's very unique. Working with other students, the collaborative part of it, I thought that I was coming and I'm not prepared, and I realized that I have a lot of inputs that were collaborative with other students, and just the policy part of learning more about how the World Health Organization works is amazing.
Hi, my name is Monica. I'm a nursing student at Humber College. We got to meet a lot of people, and it just opened my eyes to new perspectives. At first, we started our table and we got everyone's ideas and kind of thing, so I felt like I was able to contribute. With our profession, we have positions to make a change.
The students who attended today actually accomplished an amazing feat. What normally takes professionals who do this on a regular basis, days, weeks, months, they managed to do it in one day. And because they all had understood a common goal, which was to improve population health or global health, and they were able to come up with a draft resolution. So that's just astounding to me, and it's a pity that somebody who couldn't participate or even observe that. I really wish everybody would have experienced that.